Today we are going to discuss about a new topic, IV administration services. So first we are going to discuss about infusion. The infusion's primary code is 96365 and the time is 60 minutes to 1 hour. That is, if any drug is administered between a time of 60 minutes to 1 hour, we should use the code 96365. For example, the doctor nurse injected parafusive through IV administration for a 45 minutes. We should use the code 96365. Okay, and then we are going to discuss about the additional codes, add-on codes. 96366. 96366 means each additional 1 hour, same drug. That means if the doctor is administered of nurse is administered parafusive drug for about 1.5 hours, that is 1 hour and 30 minutes. So we have to use two codes, 96365. 96365 as the primary code. Okay, that is 1 hour. 1 hour we should put 96365, and the additional 30 minutes we should use the code 96366. Okay. So these two codes should be used. Okay. If it is a different drug, if the doctor administered or nurse will administer different drugs, then we will use the code 96367. Each new drug 31 minutes to 1 hour, we use the code 96367. Okay. And if there are two drugs started at the same time, that is two drugs, one parafusive and another one is any other drug, Panadol or like that, both are administered through IV. Okay, at the same time, that both I will start at the 1:30 a.m. and it finished at 2:30 or 3 a.m. Finished at 3 a.m. Both are running parallel to each other same time. So two different drugs. You should use the code 96368. Okay. These are the overall IV administration for infusion. Okay, infusion 96365 is the primary code. And the add-on code is 96366 is the each additional 1 hour same drug. If it is different drug, we use 96367. And if two drugs are running parallel to each other same time, we use 96368. Okay. Moving on to the IV push code. IV push code is the primary code is 96367. That is 60 minutes or less. For example, if the nurse administrates the parafusive for about only 15 minutes, then we cannot put this infusion code, because here the minimum requirement time is 16 minutes, but the nurse is administered the parafusive for only 15 minutes, so we cannot use this infusion code. Rather than we can use the IV push code. It is 60 minutes or less time, we should use 96374 as IV push code. Okay, so we have to down code this and we have to use 96374 IV push code. And if it is new drug is administered for about 15 minutes, okay, we should use the code 96375. Okay, and for additional 15 minutes, 16 minutes, the same drug, we should code 96376. Okay, that is, for example, the parafusive. A parafusive is administered for about 1 hour and 15 minutes. Okay. So what shall we do? What shall we do? We have to use 96365 as the primary code for 1 hour. And the additional 15 minutes we should put this code. Which code? 96376 we should code. Because we cannot code 96366 because this is minimum requirement is 31 minutes to 1 hour, but that time is only 15 minutes. So we should use 96376 additional 60 minutes, same drug. Okay, if it is different drug, if parafusive is administered for 1 hour and then Panadol is administered for 15 minutes, we should use 96365 as primary code and 96375 as secondary code. Okay, this is an outline of infusion and IV push.